I had my baby about 15 months ago and things just didn't feel right afterwards. You brace yourself when you're gonna sneeze. You think, oh, am I gonna wet my pants this time? It's a bit embarrassing. In the service station, I've wet my pants. It was horrible, it was awful.
Hi Helen, how are you doing today?
I'm really good, thank you.
How are you going with your urinary leakage? Are you finding that's improved?
Occasionally if I sneeze, it catches me off guard.
So Helen, we're just going to hop over into the bed now.
So when I first saw Helen about 12 months ago, it was just after the birth of her third child.
Good, and lifting your head again.
Now Helen was experiencing stress incontinence, which is leaking when you cough, laugh or sneeze. So that's when there is an increase in pressure within the abdomen and the pelvic floor muscles aren't strong enough to close that down. Vaginal delivery and pregnancy are a big risk factor for pelvic floor problems. The other common ones are lifting, high impact exercise or competitive sports too soon, constipation, straining on the toilet. So a lot of men that obviously haven't given birth but have got issues with constipation, that can place a strain on the pelvic floor as well.
I always knew about pelvic floor muscles, but I didn't really understand what they did.
This is the hole, the pelvic outlet. So in women, when you give birth, the baby has to come through this hole. Okay. Now there's muscles there, and they're the pelvic floor muscles. Collectively, they help to hold everything in place. So when you cough or laugh or sneeze, the muscles squeeze around those openings to help prevent urine escaping.
I thought that wearing panty liners was normal for bladder leakage, that was just how you dealt with it, that there was no other option.
So when we first saw Helen, we were focused very much on her tummy muscles. She had a very loose tummy. She had she gained a lot of weight during her pregnancy, and her tummy muscles had stretched quite a lot.
Do you want to put one of those chocolate drops in? Lisa suggested that weight loss would help with my pelvic floor issues, and it has helped them tenfold. It's been amazing.
We then examined her pelvic floor, found out what was exactly happening, and then we gave her a strengthening program to help strengthen those muscles.
That's what we call neutral spine, a nice gentle curve in your lower back. Nice deep breath in.
I didn't understand how much I could improve things with exercise, and I don't think I'd ever really had the exercises explained properly to me.
Make sure that you squeeze your pelvic floor in and up and gently pull on the tummy as well.
With going to see Lisa, it's a lot more specific as to how to do the exercises, what to do, making sure that you're doing them right.
You can see on the computer screen what your muscles are doing.
So just follow the prompts on the screen, and now squeeze with the line. Good, squeeze, keep squeezing, that's fantastic. If you were training the biceps and you were to do a bicep curl, that you can see whether the muscle's working or not. But because the pelvic floor muscles are inside you, it's really difficult to see whether they're working properly. So it's a really useful teaching tool so that the patient can see the activity in their muscles and then they can see it relax afterwards.
And that's really nice duration and relax. It's really good relaxation as well.
So we've been treating Helen for about 12 months, and during that time she's shown significant improvement in her pelvic floor strength, but even more importantly her symptoms have decreased.
It's great. It's just nice to feel normal. I don't need to worry about wetting my pants anymore. I'll avoid surgery. I've almost cured any damage that I've done through having my 3 children. Physiotherapy and learning about my pelvic floor muscles has set me up for the rest of my life.